Asthma are Tanya Winder, CEO and President of Allergy and Asthma Network, and Pulmonologist Dr. Frank Trudo of AstraZeneca. All right, Tanya, let me ask you this first. Most people have heard of asthma, but many don't realize there are varying levels of severity. So what should people know?
Yeah, Curtis, 26 million Americans are currently living with asthma here in the U.S. And as you said, about 2.6 million, 10% of those have severe asthma. So at one point we thought asthma was just a single disease, but now we know it's actually a spectrum of disease with many different types. And so we're here today to talk about that severe type of asthma. Now, this is where patients have significant impairment in daily activity. They may not be going to work or school. They're probably going to the urgent care or the ER because of their asthma attacks and asthma exacerbations. And oftentimes when they do so, they are prescribed oral corticosteroids. And so today we're here to talk about oral corticosteroids, systemic steroids, and the health risk associated with those.
Well, that's what I was going to ask is there is some concern and reports out there about the steroids. So what should people know?
Well, oftentimes when we talk to patients, they describe oral steroids as their frenemy because while they help them to breathe better, they have short-term and long-term side effects. And that's why we at Allergy and Asthma Network have partnered with AstraZeneca to do an oral steroid stewardship awareness campaign. In the short term, oral steroids oftentimes make people feel like that they can't sleep well or they have mood disturbances, they're gaining weight. In the long term, there can be serious side effects like glaucoma, heart disease, or osteoporosis. So oral steroids really in the short run can be good, but in the long term, they are a cause to reconsider your treatment plan and talk to your doctor about what's going on with your type of asthma.
Well, Dr. Trudo, let me ask you, what should people do out there if they're trying to keep this under control, get their asthma under control, and they're using these steroids?
Yeah, well, it's important to know what type of asthma that you have, because not all asthma is the same. For patients, for asthma attacks that result in urgent care visits or the use of oral steroids, it's possible that your treatment plan isn't working for your type of asthma. Unfortunately, this is a common experience for some patients with a type of severe asthma called eosinophilic asthma or E-asthma. Eosinophils are a type of white blood cell and part of the immune system, but for some with severe asthma, they can lead to airway inflammation and severe asthma attacks. Up to half of patients with severe asthma have elevated eosinophils in their lungs, and without an E-asthma diagnosis, they can often follow treatment plans that are not specifically tailored to their type of asthma.
Well, look, there's so much to cover on this topic, and I'm sure a lot of people have questions out there. Where can people get information and resources to help them?
So your audience can go to allergyasthmanetwork.org to learn more about the oral steroid stewardship campaign or the easthma.com website to learn about eosinophilic asthma and the type of asthma they may have.
I appreciate your time, you guys. Thanks for sharing the information.